Not sure if you have a serious shoulder issue or not. Frustrated with this annoying pain in your neck, your upper trap, your shoulder, or even down into your arm. It can be confusing dealing with this pain when you don't know what truly the problem is or what's causing it. And not having any proper testing is going to leave you confused without answers. The key here to figuring this out are these specific range of motion and nerve tension tests that are going to tell you exactly what is going on so you know how to treat it properly. It's also going to tell you whether you have an issue or you don't. So without further ado, let's get into the topic for tonight, range of motion and nerve tension, right? These are must-do neck tests. These are things you need to do if you want to see if your neck is truly involved with your shoulder pain. And if you've been sitting there rehabbing your shoulder and the pain is coming from your neck, you're obviously not going to get better and you could potentially make it worse. So listen up. Starting with the neck test first, you're going to look at the cervical spine, which is the neck, right? It's a fancy term for it. There are about 7 vertebrae in total, starting from C1 at the kind of base of the head, ranging all the way down to the base of the neck to C7. There are 4 different directions that we're going to look at and assess here as we go through the range of motion of the cervical spine. Right? Test number 1 is going to look at cervical flexion, which means bending your chin down towards your chest. Okay, we want to look at range of motion. Sometimes the physical therapist can measure that range of motion as well using an inclinometer if you're seeing them in person, or they can measure it as well online using an app and technology. The second motion is going to be cervical extension. That is the opposing motion where you're looking up to the ceiling and your head's going straight back to the wall behind you. You're going to measure that range of motion compared to the norms. The third test is going to be a side bend. Okay, with that, your shoulders need to stay completely relaxed. A lot of people tend to tense up their shoulders and shrug too much, which gives you a false reading. So you want to make sure you imagine like you're holding 2 heavy dumbbells so your shoulders are relaxed down by your sides and you're just dragging one ear over to the shoulder, right? Left ear to the left shoulder and right ear to the right shoulder, and you're measuring that degree of range of motion. And our fourth and final test is going to be looking at another motion called cervical rotation. So your ability to just rotate all the way to the right and all the way to the left. And if we do that properly, our chin should be able to get in line with our clavicle bone here right on the side. And if you're short of that, it might be some restrictions or some tightness there that we need to address and work on in order to get out of your shoulder pain. Now, this is the most important thing. Yes, we just went through the range of motion screen looking at flexion, going forward, extension, going back, right? Lateral flexion or side bending, going side to side, and then rotation, going turning side to side. But we want to always ask our clients, and we do this as part of our assessment process, where do you feel that? Do you have pain with that? Do you have any stiffness with that? And we're going to compare what they tell us subjectively to the objective measurements that we're taking. And that subjective and objective information together is going to give us both pieces of the puzzle so we can create a proper and specific rehab plan so that person can do very, very well in our program with our online shoulder rehab. Now, we want to get into the nerve tension tests. Okay, I mentioned at the beginning of the call. Now, the nerve tension test is really going to look at the median nerve because that is the most common nerve that gets affected through the neck down kind of into the arm. And it's the one that is most commonly involved with shoulder issues, and it's the one most commonly researched as well. So that's why we're going to kind of look at this in detail, and that's why we look at it in everyone, no matter what the issue is, whether it's neck, shoulder, upper trap, or arm pain, we want to address this. For the nerve tension test, what we're going to do is we're going to bring the painful arm out to the side. That is step 1. Step 2 is we want to depress the scapula, meaning we want to push that arm down towards the ground. Step 3 is we want to reach the fingers to the wall behind us, which is going to create wrist extension, meaning you're going to extend your wrist backwards almost like you were holding a tray or a plate if you were a server. And step 4, the final step, is you want to side bend your head away from that arm. So if you're doing and testing your right side, that's your painful side, and your wrist is kind of all the way back to the wall, then you're going to bring your left ear to your left shoulder in the opposite direction. And if this elicits pain down the shoulder and the arm, then this is telling us that the pain is coming from the nerve, aka the neck. Now, before you go all crazy, like I need to treat my neck, I don't need to treat my shoulder, you may have to treat both at the same time along with the mid-back, which is what we talk about in our NTS method that we have our online shoulder clients do. But just realize if there's a nerve issue, there's going to be symptoms that are very specific in nature and they're going to be in certain areas. Okay, so let's go over that really quickly. Neural symptoms involve radiating, numbness and tingling, hot and cold sensations, or even shock-like sensations. So if you have those, they can stem anywhere from the neck all the way into the upper trap, down the shoulder, and down into the arms. And if your nerve is truly affected, then you're going to have symptoms radiating anywhere from the neck down to the upper trap, into the shoulder, down the arm. And if it's the median nerve that's affected, which is the one that we tested, you're going to have symptoms specifically in certain fingers here. Okay, it's going to be involved in the thumb here, right? The index finger, the middle finger as well, and half of the ring finger here. Okay, if you have symptoms just on these two, right, the kind of index finger here and the pinky finger, then it's going to be ulnar nerve. If you have symptoms on the top of the forearm here in this area and the top of the hand, that's going to be radial nerve. Okay, we're not going to talk about those things in detail, but we just want to let you know that there should be a different treatment based on where your symptoms are and what they feel like. So, this nerve test is just one of many tests that we take our clients through during our specialized NTS method process, where we kind of are helping them on Zoom in a 1 hour assessment. This ensures that we know exactly what your problem is and we know exactly how to fix it. Text me the word shoulder to 1-475-241-7993, and I will send you a free shoulder pain fix demo so you can learn our NTS method and get pain free. And as always, guys, thank you so much for tuning in. Be sure to like and subscribe to the channel so you don't miss anything on learning how to deal with your shoulder pain. And remember, with the NTS method, we always want to look at neck referral, thoracic spine restrictions of the mid back, and scapular dysfunctions, meaning weakness of those surrounding muscles around your shoulder blade. All right, that's it for now. Have a great rest of your day.